Dobrý den všem. Dnes v rámci školení Fascial Fitness Introduction Course máme možnost položit pár otázek doktoru Robertu Schleipovi, světově uznávanému expertovi v oblasti fascií, který toto víkendové školení vede. Hello Robert. I have a couple of questions and I would like to ask you what is the Fascial Fitness? Could you explain us?
It's a suggestion that you could include some components in exercise and training and yoga and Pilates that are targeted, that are aimed more at the collagen connective tissue called fascia than at the muscles or at the cardiovascular endurance.
And this is the concept. We have like some components. You can tell like a little bit more specific what we are doing during the Fascial Fitness.
Yeah, so one component are elastic recoil movements. So if you're rope skipping, can be, if you do it adequately, very good strengthening for the Achilles tendon, more than for the calf muscles. So we are reinventing or rediscovering elastic recoil, bouncing movements, and we see adequately calibrated bouncing movement as one way of increasing the elasticity. So it means the storage capacity of fascial tissues, but also their resilience. So how much strength they can take without tearing. So that would be one component, the elastic recoil.
And do you have more components?
Yes, yeah, you ask very nice way because you know it. So the other ones are multi-joint stretches. So we look at stretching again. You can do a stretch only for one muscle, but you can do long chains. And if you do stretching not for the muscles, but primarily for the fascial envelopes, then you do more angular variations. So not one precise correct way, but many variations is more fascia friendly. That would be the second component.
Yeah, and then we have like two more, right?
Two more. And the third one you should talk about, which is the foam rollers and other tools that we use, which is called myofascial release or self-myofascial release, where we put our weight on certain tools that you know very well and do a slow sponge-like squeezing, rolling movement in order to get old water moved out of the tissue in a kind of a renewal way. So that is one application, how we do the rolling.
And the last component of the Fascial Fitness?
And the last one is not new at all, but we decided very strongly that needs to be included, particularly if you do elastic bounding, is proprioceptive refinement. So we use our fascia to feel our body more precisely. And that's where we learn from children, that's where we learn from many other movement therapies, that we try to become a friendly somanoid, so somebody who lives in the body with a friendly discoverer perspective. And we feel the body, as we learned in the last few years, not only with our joint receptors, which are deep in the capsule, not only with the skin, not only with the muscle spindles, but primarily with our large fascial envelopes. And that's why they all fit together so well.
It sounds good, very interesting. And then how can help this fascia research for the people, for the daily life, or for example in some performance trainings?
For performance athletes, it's quite good because the speedy acceleration that you have when you jump, we learned in the last few years, most of the accelerating speed comes from the tendons when they recoil. So if you want to jump higher, you should learn from fascia research. How can I not only make my muscles stronger and contract faster, but when they contract, so this would be the muscle, it pulls on the Achilles tendon, and then the Achilles tendon does the actual acceleration. So how can I also increase the elastic recoil capacity in the tendon? So that would be for the athlete.
And how is your feeling? The people using in the performance now it's more than it's going.
It's going, particularly the top athletes. So they have been already using fascia-oriented treatments in the past, and now they are doing it more targeted.
And what about daily life for
Yeah.
the people, for not athletes?
Yeah, so there is also a big thinking. For example, for back stability and prevention of low back injury, we used to think about the back muscles mainly and about the discs. But now we discover that probably a big percentage of low back pain are micro injuries or other overloading symptoms from the lumbar fascia. Now, in terms of normal people, back pain prevention exercises, we include bouncing movements. Our parents did that in dancing, but they didn't think of back pain prevention. So in back school, if you do exercises that people don't get so much back pain, we include bouncing movement, but also stretching, various angular variations, etc., and your wonderful foam rollers.
Yeah. So we can say generally that it's fascia research can bring the people like information how to move better.
Yeah.
Right?
Yeah.
This is the
And also it's related to elegance. This is very nice. So going in a gym and pumping muscles may make you a more graceful mover, but probably not so likely. But if you do a fascia gym where you feel your body better and you get that elastic recoil in there, it also has an aesthetic component.
Okay. So I have a last question. It's do you have in your mind something what you like to research and bring new like information for the people for the performance training? What kind of information is it?
Well, one research that we are after at Ulm University is how come that when people have high stress, sympathetic emotional stress in their life, their tissue often gets rigid. And not only the muscles, but the fascia. How is the link happening? And we want to understand that more. It may be the acidity, it may be certain cytokines that you have more in your body. If you understand that more, and you know you have a stressful period in the next 3 months because of an important exam you have, you know, how could we change your yoga or your nutrition in the next 3 months that your body is not shortening so much. So that is one line of research.
Maybe I have more question. How is the connection about the food and the fascia? Do you think that it's how can influence the food, the supplement, like the fascia?
Certainly, yeah. So anything that you read or know about anti-inflammatory diet or pro-inflammatory as a negative one, that would be also very bad for the body because it fosters fibrosis. And fibrosis means it makes you dense and stiff.
Okay. And then, do you think that can happen that you said that you will tell yourself after 3 years that it's like different?
Yeah. So it could be that anything I said today, I may need to verify in 3 years. So maybe then we will eat on purpose pro-inflammatory diet for 3 days, and then we don't eat for 2 days or do a yoga stretch for 20 minutes in order to ignite the chemistry, but we don't know. So this is only the best guess based on the little science that we currently have.
Okay, thank you for your
Thank
answering.
You very much.
It was very interesting.
Thank you.